Hello, welcome to my YouTube channel, Mr. Nawaz. I am speaking Hasib Nawaz, ex-pharmacist Hamad Medical Corporation, present Tehsil Headquarter Hospital, Kulachi District, Deir Ismail Khan. I will tell you about the corona vaccine update and the vaccine safety for the humanity. I will tell you about the details of the side effects of some of the vaccines what we are using. So it is important to know that whenever you are using the corona vaccine, uh, even before the vaccine you shouldn't take any painkillers, and even after the vaccine use there is no need to use any painkiller, because there is some new research recommendations that when you are using non-steroidal anti-inflammatory drugs, it impacts directly on the immune system. So if you have mild fever or you have some fever, so you shouldn't use any of the painkiller or any of the non-steroidal anti-inflammatory drug like Panadol, like ibuprofen, like aspirin. Yes, in case of high fever or any exceptional case you can use, but in case of mild fever or normal fever you cannot use any of the non-steroidal anti-inflammatory drugs. You should try to take external something like lidocaine, like prilocaine, like amla, like something which applied at the injection site. And you should take sugar water, which is made of 50% contain sugar or 25% contain sugar. So you should take before the injection sugar water, then it will decrease the pain of the injection. But you should not take the non-steroidal anti-inflammatory drug or any painkiller at the time of injection, before or after the injection of the corona vaccine. And the second important thing is that what the people with the diabetes, or the people with the blood pressure, or the people with the severe diseases who are injecting the corona vaccine, and after injection both doses there is no rise in the antibodies, so you should take even booster dose after 14 days. It is recommended to take a booster dose of different type of vaccines in order to raise the level of antibodies in your body. So it is recommended that in case of diseases or in case of any condition, when you are on chemotherapy or another drugs, when your immunity didn't boost to the point where you can prevent yourself from corona virus, so you can even take at that time the third dose of the vaccine. It is recommended. Or those people who want to take a booster dose after 5 months, 6 months, or 7 months, or 8 months of the second dose, so you can also take after second dose, 6 months after second dose, a booster dose of vaccine, in order to satisfy yourself that you are fully prevented from coronavirus and its disease. So it is the third thing about the COVID-19 is that COVID-19 virus and its vaccine is that its safety in all age people 18 plus years of adults. So it is easy to take the vaccine for all type of persons, whether they have diabetics, whether they have hypertension, whether they are obese, whether they are with the diseases, except for those people with having a medication like immunomodulator, like chemotherapy medication, cancer therapy medication, like high dose steroids. So they may prevent the vaccination or may stop the medication for 2 weeks after the vaccination, and then can start after 2 weeks the medication. So it is important for a person to know all about these things. The persons with on chemotherapy medication, on immunomodulators, on high dose steroids medication, they cannot take the vaccination if they are using these medication. If they stop the medication, they can take, and after 14 days they can start again these medication. So it is easy for them. And if a person and after taking two doses of medication, and if they check the antibodies of the COVID-19, so if they didn't develop any antibodies against COVID-19, so he can take after 14 days a booster dose. And a person who want to prevent fully, and he want a booster dose, he can give a booster dose 6 months after the second dose of the vaccine, corona vaccine. So it's allowed now that after second dose of the vaccine, you can after 6 months after the second dose of the vaccine, you can take a booster dose. It is now allowed. So if a person wanted to take a booster dose, after the second dose he can take after 6 months as booster dose of any type of any vaccine. Thank you so much.